हेलो एवरीवन, वेलकम बैक टू आवर चैनल NurseAdda। अगर आप में से कोई ESIC, RRB, NORCET, AIIMS, CRE कोई भी नर्सिंग कॉम्पिटिटिव एग्ज़ाम की तैयारी कर रहे हैं तो आप बिल्कुल सही वीडियो पे आ गए हो। ओके, हम लोग डेली आप लोगों के लिए लेकर आते हैं नर्सिंग रिलेटेड सैम्पल पेपर और आज हम लेकर आए हैं आपके लिए NORCET एग्ज़ाम का रियल पैटर्न बेस्ड सैम्पल पेपर। 16 सेट नॉर्सेट एग्ज़ाम पैटर्न का हम लोग ने ऑलरेडी अपलोड कर दिया है यूट्यूब पर। ओके, ये होने वाला है आज का सेट नंबर 17। जो लोग ने नहीं देखा है जाके चेक कर लीजिएगा, रिवाइज़ करो, अपना बेस को स्ट्रॉन्ग करो। ठीक है, बिना टाइम गवाए आज का सेशन स्टार्ट करते हैं। आज होने वाले टोटल 100 क्वेश्चंस, 80 रहेंगे नर्सिंग से रिलेटेड एंड बाकी 20 के रहेंगे जीके, इंग्लिश, कंप्यूटर, मैथमेटिक्स के ऊपर। ओके, चलिए शुरू करते हैं। Question number 1. A patient receiving digoxin has an apical pulse of 52 beats per minute. What should the nurse do? Your correct answer is option C. Withhold the dose and notify the healthcare provider. Okay. So here apical pulse is 52 beats per minute, that is bradycardia. Okay. Explanation is bradycardia can indicate digoxin toxicity. The nurse should withhold the medication and notify the healthcare provider according to protocol. Okay? ऐसे ही डेली वीडियो देखने के लिए आप लोग चैनल को सब्सक्राइब कर लीजिए, बेल आइकन को प्रेस कर लीजिएगा। ओके, नेक्स्ट क्वेश्चन, विच फाइंडिंग इज मोस्ट सजेस्टिव ऑफ इंक्रीज्ड इंट्राक्रैनियल प्रेशर? योर करेक्ट आंसर इज ऑप्शन ए, bradycardia with widened pulse pressure. Explanation is bradycardia, widened pulse pressure, abnormal respiration, all are the components of Cushing's response, which is a late sign of increased ICP. Okay. Next question, a patient with hypovolemic shock has BP 80 by 50 mmHg. Heart rate is 128 beats per minute and cold clammy skin. Which intervention should the nurse prioritize first? Your correct answer is option A, administer IV isotonic fluid. Explanation, hypovolemic shock requires rapid restoration of circulating volume. Isotonic IV fluids such as normal saline are commonly used initially. Okay. Next question, a patient develops sudden facial drooping and right arm weakness. What should the nurse determine immediately? Your correct answer is option B, exact time symptoms started. Explanation, in suspected acute stroke, determining the time of symptom onset or last known well is crucial for treatment decisions. So here timing is very important for the treatment decisions. Okay. Next question, which finding is most concerning in a patient with severe asthma? Your correct answer is option C, silent chest. Explanation is a silent chest may indicate extremely poor airflow and impending respiratory failure. It is an emergency finding. Next question, question number 6. Palpable gallbladder in a jaundiced patient due to biliary obstruction is called. Your correct answer is option B, Courvoisier's sign. Explanation, a painless enlarged gallbladder with jaundice suggests obstruction of the bile duct, known as Courvoisier's sign. Next question, a patient shows sign of hot spot on his leg cast. What does this indicate? Your correct answer is option A, sign of infection. Next one, an excessive high heart rate that is more than 170 beats per minute, can cause? Your correct answer is option B, decreased cardiac output. Explanation: very fast heart rate gives the heart less time to fill with blood, so cardiac output can decrease. Next question: a child undergoes heart surgery for tetralogy of Fallot. Which behavior should the nurse prevent to avoid post-op complications? Your correct answer is option A, crying. Explanation: excessive crying increases the baby's oxygen demand and cardiac workload, so better to keep the baby calm. Next question: a patient with COPD has shortness of breath and SpO2 of 60%. What is the priority nursing intervention? Your correct answer is option B, oxygen administration. Next question: during a cleansing enema, the client reports abdominal cramping. What should the nurse do first? Your correct answer is option B, clamp the enema tubing. Next one: a postpartum woman has delivered a newborn following a pregnancy complicated by placenta previa. Which complication should the nurse monitor for? Your correct answer is option A, hemorrhage. Placenta previa increases the risk of heavy bleeding, that is hemorrhage. Next question, question number 13. Salicylic acid is prescribed for a patient with psoriasis. Which finding indicates salicylate toxicity? Your correct answer is option A, tinnitus, the ringing of ear. Ringing in the ears, tinnitus, is an early sign of salicylate toxicity. Next question. What is the purpose of neomycin administration before surgery? Your correct answer is option A, prevent post-op infection. Explanation: neomycin helps to reduce intestinal bacteria before certain surgeries and lower the risk of infection. Next question: what is the normal range of CVP or central venous pressure? Your correct answer is option D, 5 to 10 cm H2O. Next question: what is the most potentially dangerous complication of chronic peritoneal dialysis? Your correct answer is option A, peritonitis. Next question: after delivery, which intervention is appropriate to prevent heat loss in a newborn due to evaporation? Your correct answer is option D, drying the infant with a warm blanket. Explanation: a wet newborn loses heat through evaporation. Drying the baby immediately with a warm towel or blanket prevent heat loss. Next question: a newborn with hyperbilirubinemia is being breastfed. Which instruction is appropriate? Your correct answer is option C, continue breastfeeding every 2 to 4 hours. Explanation is frequent breastfeeding helps the baby pass more urine and stool, which helps to remove bilirubin from the body. Next question: a patient is admitted with a suspected brain tumor. which is the most reliable indicator of cerebral status? Your correct answer is option C, level of consciousness. Next one, in COPD patient, secondary polycythemia develops mainly due to. Your correct answer is option A, chronic hypoxia. Rationally, in COPD, it can cause low oxygen level which stimulate the kidneys to produce more erythropoietin and increase RBC production. Okay. Next question. What is the priority nursing intervention when preparing a child for admission with acute laryngotracheobronchitis? Your correct answer is option C. Place a tracheostomy set at the bedside. Explanation is laryngotracheobronchitis can cause airway obstruction, so emergency airway equipment should be readily available. Next question. Nature alone cures. What nursing has to do is to put the patient in the best condition for nature to act upon him. Who said this? Your correct answer is option A, Florence Nightingale. Explanation is this statement reflects Florence Nightingale's environmental theory and her belief in nature's role in healing. Next question. HCG is secreted by. Your correct answer is option C, trophoblast. Explanation. HCG is produced mainly by the syncytial trophoblast of the placenta. Next question. A pregnant woman should start taking IFA tablet from. Iron and folic acid tablets from. Your correct answer is option B, second trimester. Rationally, under the standard Indian antenatal supplementation schedule, routine IFA prophylaxis is started after the first trimester, that is, from the second trimester. Next question. Fetoplacental circulation begins from. Your correct answer is option C, 21st day. Next one. Which of the following drug does not cross the placenta? Your correct answer is option B, heparin. Rationally, heparin is a large molecule, so it does not cross the placenta significantly. Next question. Karyotype of Klinefelter syndrome is. Your correct answer is option A, 47XXY. Explanation. Klinefelter syndrome occurs in males with an extra X chromosome, that is 47XXY. Next one. What is the presenting diameter in Bro presentation? Your correct answer is option A, mento-vertical. Explanation. In Bro presentation, the fetal head is partially extended and the mento-vertical diameter presents. Next one. Which of the following drug is not a tocolytic drug? Your correct answer is option D, misoprostol. Explanation. Misoprostol causes uterine contractions, so it is not used as a tocolytic agent. Next question, question number 30. A patient has undergone surgery. Which nutrient is especially important for tissue repair? Your correct answer is option B, proteins. Explanation is protein helps in tissue building and wound healing after surgery. Okay. Next question. The difference between systolic and diastolic blood pressure is called. Your correct answer is option A, pulse pressure. Explanation is pulse pressure is equal to systolic BP minus diastolic BP. For example, 120 by 80. If BP is 120 by 80, then pulse pressure is equal to systolic BP, that is 120, minus diastolic BP, that is 80, is equal to 40 mmHg. Okay. So by this formula we can find out the pulse pressure. Next question. The difference between apical pulse and radial pulse is called. Your correct answer is option A, pulse deficit. Next question. Which term describes doing no harm to the patient? Your correct answer is option C, known maleficence. Rationally, known maleficence means do not harm. Easy trick to remember is known maleficence means no harm. No maleficence, no harm. Okay. Next one. During NG tube insertion into the oropharynx, the patient is having coughing and gag reflex. What should the nurse do first? Your correct answer is option D, wait and reinsert. Next one, during NG tube feeding, the patient should be placed in which position? Your correct answer is option D, upright position. Next question, Hagar's sign usually occurs at. Your correct answer is option A, 6 weeks. Explanation, Hagar's sign is softening of the uterine isthmus and it may be present around 6 weeks of pregnancy. Next question, a patient with myasthenia gravis has an episode of epistaxis. What is the most important nursing priority? Your correct answer is option C, airway clearance. Explanation is in myasthenia gravis, respiratory muscles can become weak. Therefore, maintaining a clear airway and adequate breathing is the priority one. Next question. What is the effect of a HOT application? Your correct answer is option A, increased blood flow due to vasodilation. Next question, decreased BP, rapid respiration, cold clammy skin, pale skin and decreased urine output all are the clinical features of. Your correct answer is option A, hypovolemic shock. Next question, after cardiac catheterization, which site should be assessed to evaluate peripheral circulation? Your correct answer is option C, distal to the insertion site. Rationally, check the pulse below the catheter site to make sure blood circulation is adequate. Next question, a patient taking disulfiram drinks alcohol. Which reaction is expected? Your correct answer is option B, nausea, flushing, tachycardia and low BP. Next question, which findings suggest IV infiltration? Your correct answer is option D, pale, cool, swollen and painful site. Next question. In ectopic pregnancy, which decidua is shed? Your correct answer is option C, decidua vera. Next one. In the clotting mechanism, prothrombin is converted into thrombin in the presence of. Your correct answer is option C, calcium ions and prothrombinase. Next question. A patient with urinary catheterization is admitted to the ward. Where should the catheter be taped to prevent pulling? Your correct answer is option A, inner thigh. Next one. What is the main action of histamine H2 receptor antagonist? Your correct answer is option B, decrease gastric acid secretion. Next question. A patient taking isoniazid for tuberculosis should also receive. Your correct answer is option D, pyridoxine. Explanation is isoniazid can cause vitamin B6 deficiency, so pyridoxine is given to prevent neuropathy. Okay? Next question. Hemophilia A occurs due to the deficiency of. Your correct answer is option C, factor 8. Next one, a patient scheduled for hysterectomy has a WBC count of 9800 per millimeter cube. What should the nurse do? Your correct answer is option A, document the finding. Next question, movement of thumb toward the little finger is called. Your correct answer is option A, opposition. Next one, a pair of identical alleles is called. Your correct answer is option A, homozygous. Next one, which disorder is commonly seen in a rape survivor? Your correct answer is option C, PTSD. Explanation is a traumatic event such as sexual assault can lead to PTSD or post traumatic stress disorder. Next one, ringer lactate solution is contraindicated in which condition? Your correct answer is option D, lactic acidosis. Next one, Braxton Hicks contractions are. Your correct answer is option D, irregular contractions during pregnancy. Explanation is Braxton Hicks are practice contractions that are usually irregular and do not cause progressive cervical dilation. Next one, after an ileostomy, which vitamin may require special attention because it is normally absorbed in the terminal ileum? Your correct answer is option A, vitamin B12. Next question, which combination represents the 4 A's of schizophrenia? Your correct answer is option C, affect, ambivalence, autism, loosening of association. Next question, which is a positive symptom of schizophrenia? Your correct answer is option B, hallucination. Next question, a patient develops acute confusion, that is delirium. Which intervention is appropriate? Your correct answer is option A, arrange a room with dim light. Explanation is a calm, quiet, and appropriately lit environment can help reduce confusion and agitation. Next one, looking at the world mainly from the perspective of one's own culture is called. Your correct answer is option A, ethnocentrism. Rationale is ethnocentrism means judging others' cultures using your own culture as the standard. Next one, if glaucoma is not treated, it can lead to what? Your correct answer is option A, blindness. Next one, during pelvic examination, vaginismus is characterized by. Your correct answer is option A, involuntary spasm of muscles around the vagina. Next question, which is a principle of a sterile field? Your correct answer is option C, keep sterile items at least 1 inch from the edge. Next one, which intervention is appropriate after rapid administration of KCL? Your correct answer is option C, administer 10% dextrose plus insulin. Explanation is insulin with glucose helps to move potassium from blood into the cells, that is lowering serum potassium level. Clinical note is rapid IV KCL administration can cause dangerous hyperkalemia and cardiac arrhythmias also and require urgent management. Next question, which finding may be seen in rabies? Your correct answer is option C, pharyngeal spasm. Next one, non-verbal communication involves. Your correct answer is option T, conveying feelings through body language. Next question, pro-social behavior is positively linked with which personality trait? Your correct answer is option B, agreeableness. Next one, a 4-month-old child with meningococcal meningitis is admitted. Which intervention has the highest priority? Your correct answer is option A, start droplet precautions. Next one, a wound culture sample should be taken from. Your correct answer is option A, clean wound after removing crust. Next question, Lugol's iodine solution is given before thyroidectomy. What is its therapeutic effect? Your correct answer is option D, decrease vascularity and size of thyroid gland. Next one, what nursing intervention should be performed during postpartum uterine fundus examination? Your correct answer is option A, massage the fundus if it is boggy. Next one, after administering medication, when should the nurse document it? Your correct answer is option C, immediately after administration. Next one, what are the major causes of mental health problems in elderly people? Your correct answer is option D, all of the above. Next one, which is a common side effect of cisplatin chemotherapy? Your correct answer is option B, nausea and vomiting. Next question, a patient has an AV fistula for hemodialysis. Which intervention promotes safety? Your correct answer is option D. Assess for build and thrill regularly. Explanation is a thrill and bruit indicate that blood is flowing through the AV fistula. Remember, no BP measurement, IV cannulation or blood sampling from the fistula arm. Next one, why should oxygen therapy sometimes be humidified? Your correct answer is option B. Oxygen is dry and it can thicken the mucus. Next one, a patient with suspected urolithiasis is on bed rest. What is the priority nursing intervention? Your correct answer is option A. Increase fluid intake. Explanation is adequate fluid helps increase urine flow and promote passage of small stones when not contraindicated. Next question. A 10-year-old child has decreased sensation in the legs due to cerebral palsy. What safety instruction is important? Your correct answer is option A. Test the temperature of bathwater before bathing. Next one. A patient has a flaccid bladder. Which intervention should be included in the care plan? Your correct answer is option B. Use the crate maneuver to empty the bladder. Next one. What is the immediate treatment for a dog bite? Your correct answer is option C. Wash the wound thoroughly with soap and water. Next one. A is 20% more than B. Their total work is 110. What is B's work? Your correct answer is option A 50. Explanation is let B is 50. Then A is 20% more, that is 60. 50 plus 60 is also 110, which is mentioned in question. Okay. Next question. Which symptoms would you expect in a patient with hyperpyrexia? Your correct answer is option D, all of the above. Next one, what sound is heard when percussing a distended bladder? Your correct answer is option A, dullness. Next one, which test is used to check balance in a patient with ataxia? Your correct answer is option A, Romberg test. Next one, a patient receiving internal radiation therapy feels lonely because visitors are restricted. What is the priority nursing intervention? Your correct answer is option A. Discuss the risk of radiation therapy. Next question. Genetic counseling is which level of prevention? Your correct answer is option A. Primary level. Primary level. Okay. Explanation. Genetic counseling can help prevent or reduce the risk of genetic disorder before they occur. Next one, a patient with rheumatoid arthritis is taking aspirin 300 mg daily. Which finding indicates an adverse effect? Your correct answer is option A, tinnitus. Next one, which is the national reptile of India? Your correct answer is option A, king cobra. Next one, G20 Digital Innovation Alliance was inaugurated by. Your correct answer is option C, Rajiv Chandrasekhar. Next one, When was Chandrayaan 3 launched? Your correct answer is option B, 14th July 2023. Okay. Next one, which is the first month of the Indian national calendar? Your correct answer is option C, Chaitra. Which type of breath sound is commonly heard in patients with pulmonary edema? Your correct answer is option B, rails or crackles. Next one, a central venous catheter can be inserted into all of the following veins except. Your correct answer is option D, saphenous vein. Next one, which antipsychotic drug causes minimal extrapyramidal symptoms or EPS? Your correct answer is option A, clozapine. Clozapine is the right answer. Okay, clozapine. Next one, a railway station is 5 km east of a person's house. The post office is 5 km south of the railway station. In which direction is the post office from the house? Your correct answer is option B, southeast. Next question, select the correct arrangement. Your correct answer is option B, river, dam, turbine generator, then electricity. Next one, select the correct sequence. Your correct answer is option C, crime, police, FIR, court. Next question, in a 50-over cricket match, Team B needs 200 runs from the last 20 overs. What is the total score Team A should have scored if the record run rate was 5 runs per over for the first 30 overs? Your correct answer is option B, 349. Explanation is first 30 overs 30 into 5 that is 150 runs. Next 20 over is 20 into 10 that is 200 runs. Total is 350. So team A score is 349. Okay. Next one, school is to teacher, then court is to what? Your correct answer is option A, lawyer. If a number is increased by 20%, it becomes 360. What was the original number? Your correct answer is option B, 300. Explanation is 120% of the original number is 360. So original number is 360 into 100 divided by 120. That is 300 only. Next question and our last question is, which part of the brain controls vital functions such as breathing, heart rate and blood pressure? Your correct answer is option C, medulla oblongata. इसी के साथ हमारा आज का सैम्पल पेपर यहीं ख़त्म होता है। अगर आपको वीडियो थोड़ा सा भी हेल्पफुल लगे तो वीडियो को लाइक करें, शेयर करें और चैनल को सब्सक्राइब करें। ठीक है, कल वापस मिलेंगे एक नए वीडियो के साथ, एक नए मॉक टेस्ट के साथ।